Hi, my name is David Emerson. I'm a long-term cancer survivor, cancer coach, and director of People Beating Cancer. Welcome to the vlog post about one of my very favorite topics, recovery after a stem cell transplant. And in my experience, this could be recovery from either an allogeneic stem cell transplant or autologous stem cell transplant. Either a donor stem cells or your own stem cells. I say that mostly because, I went through an autologous stem cell transplant myself about 30 years ago, though I did few of any of the things immediately during the year that followed. And I've learned the hard way of what I think would have helped me during especially that first year. Some of the therapies are long-term, such as diet, sleep, readjusting your circadian rhythms. Some of that's more evidence-based. There's studies that show how the patient's circadian rhythms get turned around with aggressive chemotherapy. All to say, the patient undergoes or is considering a stem cell transplant or has undergone a stem cell transplant recently. There are therapies that I believe will help you recover. First and foremost, it's possible that you'll experience side effects that are more dramatic than you thought going into your stem cell transplant. In my experience, conventional oncology has very little time to walk you through all the different things that might happen to you. You might feel more fatigued. You might be surprised by how fatigued you are. Learning about evidence-based therapies to help fatigue is important. It's very helpful. Learning about chemo brain. I've written a lot about chemo brain. Learning about diet, learning about, there's conventional therapies that aren't designed specifically for an autologous stem cell transplant, such as Ritalin. Chemo brain patients who experience chemo brain, Ritalin can help. Sleep, exercise, nutrition are a number of things that can help you manage, especially again, that first year. I'm not saying that all the side effects will be gone that first year, but I think those therapies, both conventional and non-conventional, can help you reach the new normal almost completely 100%, but you can get there. Some patients do. I'm cautious only because some patients do feel pretty good in the months, year after. Some patients have a more difficult time. There really is a spectrum. It's difficult to anticipate because everyone reacts differently. I would encourage you to join an online stem cell transplant group. People who have had a stem cell transplant understand it, I think, better in many ways than conventional oncologists. So talking to people who've been there, who've done that, can help you. They can tell you what they experienced that may or may not apply to you. Learning about things helps. At least it's helped me over the years. In any case, certainly subscribe or scroll down, click through to the blog post, read the specifics. If you have any questions or comments, you can ask me a question. I'll get back to you ASAP. I don't pretend to have all the answers, but I've learned a lot having lived with a stem cell transplant for 30 plus years. Certainly, thank you for your time, attention, and don't hesitate to ask questions. That's what I'm here for. I hope all is well, and thank you for your time.